Right, let's begin with the class. So, welcome to first of all, let me welcome you to Let's Crack NEET PG. Right, that's the YouTube channel of An Academy, their NEET PG division. So, I would like to welcome you to that. This video, it's not a live video. It's going to be a premiered video. So, this video has two parts to it. The first part of the video is the subscription pitch, and after that, you will move on to whatever the content of that video is, whatever I'm going to be doing, right? So if you want to skip ahead, you can skip through the subscription pitch, right? Scroll through the taskbar, and you can reach to the end of the subscription pitch where I will be telling you everything about the Unacademy subscription, the Unacademy Plus, and the Unacademy Iconic subscription. And you can skip ahead of that, and you can move ahead to the content. So again, let me welcome you to Let's Crack NEET PG, the YouTube channel. So for the YouTube channel here, you have the top educators, right? So we are the top educators here who are going to be teaching you on Unacademy, and we'll be giving you quality content. And I assure you that this video will be a great learning experience for you all. You might have watched our live videos. Now, during this time, we are uploading these premiered videos, right? And they're recorded sessions for you, which are in a very concise and structured manner, so that whatever we give to you, you can retain it efficiently, right? So learning should never stop. So first of all, if you're wondering who am I, and if you've not watched any of my live sessions or recorded sessions, so my name is Chaitanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi, right? Which might be a dream destination for you. And my All India rank was 4 in the AIMS UG entrance examination, and my All India rank was 5 in the JIPMER entrance examination. As you all know, all of these examinations have been merged under a single name, the NEET examination, the results for which were declared recently. So now it's all as the NEET examination. For the NEET PG, this is the NEET UG examination, and you all know that for NEET PG right now, the exam is the NEET PG examination. Then you have separate exams for AIMS, PGI, and JIPMER. But this year, Central Institutes, they're combining AIMS, PGI, JIPMER, and NIMHANS under a single exam called as the INICET, right? And it is proposed that both of these exams will be replaced by the next exam. The next exam pattern has a lot of clinical weightage, and only around 10% of the weightage goes to pre and paraclinical subjects. So that is about this. And right. So before I move on to the content, I want to tell you about Unacademy. It is my job to tell you about the Unacademy learning app, the Unacademy platform as such, and the Unacademy subscriptions, which are the most useful things for you, right? So first of all, do one thing. No matter what, don't think about any purchases, don't think about any subscriptions. Just go ahead and download this free Unacademy learning app. Go ahead and install it, and I'll tell you how this will be useful to you, right? This already has over 10 million plus downloads, so don't worry about anything. Just go ahead and install the app. And as you can see, it is the number 3 top free app right now, right? So a lot of people are already using an academy to learn. Top educators, including me, are teaching you here, right? You can see that there are a decent number of watch minutes, there are a decent number of followers that are already connected with all of these people. You can see here around at least 12,000 people are connected right now with a few educators, right? And it's a constantly growing thing, all right? So we educators, we are creating structured courses for you on an Academy Plus, right? So all of these courses, they are plus courses, and as you can see, these are locked, which means that you will be able to access them if you have a plus subscription, right? So you will ask me, फिर app क्यों download करवा दिया, है ना? So all of these are plus courses. So educators, so for example, if you want to have a complete course on genetic and metabolic errors in pediatrics, right? So you can see that there is a course here which has 6 lessons, pediatrics course here that you can be learning from, right? Similarly, if you want a foundation course, right, which are batch courses, you can see courses such as these. These are batch courses where multiple educators are teaching together for a particular subject, right? Now, the reason I told you to download the app was these special classes. So as you can see here, that educators keep taking free special classes for NEET PG on an academy, right? These classes are completely free of cost, and you can all you need is either you can watch them on your laptop, or if you want to watch them on your mobile phone, you can just download the app. Okay, that is why I told you to download the app. So, for example, if you want to know what were the questions that were asked for surgery in May AIMS 2020, this is a video for you, right? If you want to know about the embryology of the heart, there's this video for you. I had made a video on basal ganglia, right? You can access my Unacademy profile. I had made a video for arteries of upper limb. You can access this video also directly from there, from the app, right? And once you do that, so you will need my profile for that. So my profile is unacademy.com @ Chaitanya Mittal, that's my name. D5-4586. I know it's a little complicated. If you just search my name, you'll still get this there, right? There are not many Chaitanyas teaching on Unacademy. So besides that, the benefit of downloading the Unacademy Learning app is that you have the option there to attempt these free mock tests. You have the option to attempt free of cost. These mock tests are absolutely free of cost. And you can see that if you have a plus subscription, these log mock tests, you will never fall short of any kind of questions. So you can attempt all these weekly mock tests as well on the Unacademy Learning app. And there's a comprehensive syllabus coverage. This part A is pre-clinical, part B is paraclinical, and part C is clinical subjects. Besides that, you can see for clinical, you have a higher number of courses because next examination, there is a higher weightage for the clinical pattern. So accordingly, these courses have been made in a very structured way. Besides that, you also have batch courses, right? You have 4 courses now. There might be multiple. This is an old screenshot, right? And you have some courses which are there for your syllabus coverage, for your strategy, for your practice, right? All of that is covered. And this YouTube class is another free class for you, so for you to learn, right? So now, why Unacademy or why online learning is the best way to learn for NEET PG? The reason for that is we are MBBS students. We are very busy people as far as our schedules are concerned. So we need a flexible schedule for anything. We need to have flexibility in our schedules. We need to learn at our own time, at our own place, and at our own pace. All right. So you can see here that on Unacademy, you will have a class running at almost every time, right? Because there are multiple educators. You can watch at your own convenience according to your own schedule. You can watch a lecture recorded. You can watch it unlimited times, right? Then you can be watching in the language of your choice. मैं अभी इंग्लिश में बात कर रहा था, अब मैं हिंदी में भी बात कर सकता हूँ, ठीक है? When we are in a live class, if somebody asks me to repeat something in Hindi, I do that, right? And Malayalam maybe, Tamil maybe, you can basically be learning in any language, and that gets more relevant when you are doing when you're learning something that is from the non-medical portion from the UPSC side, right? And unlimited practice kar sakte ho yaar. You can attempt the quizzes again and again. You can rewatch the recorded sessions. You can also download the PDFs for everything, right? We'll also get all these PDFs on my Telegram channel. That is @NEETPG Chaitanya. That's my Telegram channel. You can also join the discussion group where you can ask any of your doubts or you can talk about a subscription. All you have to do is go ahead and download the Unacademy Learning app, and that will feel like you're right in the classroom. You can see that there's a very good chat feature here in the Unacademy app, which I also use in live classes on YouTube, where you can directly chat with the educator. And when we do MCQ classes, I have interactive polls to ask you what is the answer. I would have included questions here had there been a possibility of a live class for this particular lecture, but this lecture is in a recorded way. You can put all your doubts on the Telegram channel for this, and you have the convenience of learning wherever you want, whenever you want, right? So you can be sitting in a metro basically, and you can still be learning. So now there are 2 subscriptions that I want to talk to you about. Very important. Just listen to this part at least. There's a plus course and there is an iconic course. Unacademy Plus basically includes everything that is there on the Unacademy platform, right? You will get all the live classes, access to all live classes and all batch courses, along with the tests and quizzes. Besides that, there is a structured schedule which will be specially made for you, right? And according to that, all the courses are running, for which you will have complete syllabus coverage. You can simply select plus if you want to take the plus subscription. But I will tell you to go a little one step ahead and take the Unacademy Iconic subscription, where you're not getting just Unacademy, you're also getting Prep Ladder. Unacademy is India's largest online learning platform, no doubt. For medical education, what was going so far was Prep Ladder was the leading app, which was acquired by Unacademy. So now Unacademy is giving you both Unacademy and Prep Ladder together. And what you get here is you get everything that is there on Unacademy. And believe me, in 1 year, Unacademy will have lots of great content, right? And right now, Prep Ladder already has teachers like GRG sir for pharmacology. For ortho, you have Apurv Mehra sir, and these are very famous faculty. If you ask anyone for ortho, they'll say, go ahead, take Prep Ladder. For pharma, if you ask anyone, they'll say, go ahead, take Prep Ladder. Similarly, for medicine, for everything, Prep Ladder is a very decent thing for your concepts and subjects. Is to the point, it is concise, right? Unlike some of the other applications. And with Prep Ladder, you get all the video lectures, right? You get all the question banks, the latest question banks, naya question bank aaya hai, along with the rapid revision course. And you also get the notes. Otherwise, these notes are separately for rupees 6,500. If you otherwise try to purchase these notes, they will cost you another 6,500. But here you get these notes included. Okay, so you just go ahead, select the Iconic subscription according to me, and this is the pricing for Iconic, right? So this is the 1 year plan for 55,000. This is the 2 year plan for 77,000. For 3 year plan, it is for 92,000, right? The moment you apply my referral code, that is Chaitanya 10. So I'll just tell you there is only one referral code that you have to use on any course on Unacademy. If you are taking a NEET PG subscription, if your brother is taking a UPSC subscription, or if your sister is taking an IIT subscription or a NEET UG subscription, ठीक है, या रेलवे के लिए प्रिपेयर कर रहा है, कोई कैट के लिए प्रिपेयर कर रहा है, उनको बताना एक ही रेफरल कोड यूज करना है, चैतन्य 10. सो इस रेफरल कोड से व्हाट हैपेंस, you get a straight 10% off. You get a straight 10% off. So you can see that it is already reflecting the discounted price to you, right? So this 92,000, the 9,200 got subtracted and this became 82,800. All right. Now, besides that, if you can use credit, so just proceed to pay here. And when you do that, I will show you here. There's an option to apply credits. There's an option to apply credits. And if you contact me, I'll tell you exactly how to do that. And if you maximize your advantage, you can get a 10% off using credits as well. Just click apply. And if you use my referral code, the best advantage of using my referral code is you will also get a cashback from my end, right? And this cashback from my end, you can claim by texting me on Instagram at the rate chaitanya.blue. That is my Instagram ID. And you can also get to me on my discussion channel on Telegram, that is at the rate NEET PG Chaitanya, right? Just contact me beforehand before taking a subscription. Make sure you're a new user. Make sure you're a new user. You have a new account, right? And all you have to do is enter the referral code, apply the credits. You will also get the additional cashback. So basically, what happens is this course that costs you for 82,800. If you apply credits, right, there's a further discount of 8,000. And if with my cashback, this course will come down to 75,000 or 70,000 for you. All right. And that is really, really cheap, as you can already make out. I'll just show you the calculations. 75,000 for 3 years, and you also get 2 apps, right? So that is basically 12.5 thousand per year per app. Now, what can be cheaper than this? If you compare it to offline NEET UG coachings, which you might have taken previously, okay, that would have costed you somewhere around 1.5 lakhs per year, है ना? या फिर 1.25 lakh per year if you had some scholarship. This is almost 10 times less. This is 10 times less, and you are getting the best of both worlds. All right. So I would say go ahead, take the Iconic subscription. If you're satisfied with Unacademy, you don't want to go ahead with Prep Ladder, just take the Unacademy Plus subscription. Does not matter. And then here you will get the different pricing. For 3 years, this will cost you 50,000, right? So that was an extra around 40,000 for Prep Ladder. So Unacademy Plus is a little more expensive than Prep Ladder otherwise, because there's a difference in the content, there's a difference in the number of educators that is there, right? So there's that. And then here the referral code is Chaitanya 10. Same referral code works everywhere, and you'll get a 10% off the credits and the cashback. Everything still stands, right? You know how to reach me. On Telegram, just you'll go and you'll join the channel, you'll subscribe the channel, and there's an option to join the discussion group. Just come there and you can find me and text me. Alright, otherwise Instagram works as well. So apply कर दिया, referral code apply हो जाएगा, discount मिल जाएगा, credits लग जाएंगे. Yeah, so this was a comparison of the pricing. I just wanted to show you that this for 3 years after discount is 45,000. After discount, this is around 80,800, which will come down to 70,000 if you are able to use your credits well. Yeah, and I will give you some part of it through a cashback via Paytm or Google. All right. So let's move on to today's content. So that's about the subscription pitch. Now we are going to be moving on to today's content. Alright, so today's class is about the cubital fossa. Alright, and as I already told you, my name is Chaitanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences in Delhi. Right now, I'm in my hostel room. Let's begin with cubital fossa for now. The first thing that you need to know about the cubital fossa is that the cubital fossa is triangular. Alright, if I compare it with the popliteal fossa, so you should know that the cubital fossa, it is homologous to the popliteal fossa. Now, if you have studied the lower limb, the popliteal fossa, it is present behind the knee. Alright. So now tell me one thing, the cubital fossa, should it be present behind the elbow or in front of the elbow? It should be present behind the elbow or in front of the elbow. It should be present in front of the elbow. Now, why is that? Because your upper limb, it rotates laterally. It rotates laterally, right? And your lower limb, it rotates medially during its embryonic development. So there is a slight difference when it comes to certain things here, right? Even though the cubital fossa and the popliteal fossa, they are homologous, your cubital fossa is present anterior and your popliteal fossa is present posteriorly, posterior to the knee joint, right? Posterior side of the leg. That's because there's a difference in how the both limbs, they have their rotation of the embryonic limb buds during their development, right? That's the first point. It is homologous to the popliteal. Second thing is that it is a triangular hollow structure, right? It is a triangular hollow, the cubital fossa, right? Right now we're talking about the cubital. But what I have shown you in this diagram, I had kept a image of the popliteal fossa for you to compare. The popliteal fossa is a diamond-shaped structure. It is a diamond-shaped structure, whereas the cubital fossa is only a triangle-shaped structure. So that is the second thing that you have to remember. So when you talk about the boundaries of the popliteal fossa, you have four boundaries, right? So you have a upper lateral, upper medial, lower lateral, and lower medial. So you have four boundaries. Whereas when you talk about the cubital fossa, you will have three boundaries, right? Because you will have a base, you will have a lateral boundary, you will have a medial boundary, and you'll have an apex, right? So that's one of the another differences between the cubital and the popliteal fossa. So 2 points of difference: because of the difference in the rotation of the limb buds, the popliteal fossa is present posteriorly, whereas the cubital fossa is present anteriorly. Popliteal fossa is related to the knee joint, the cubital fossa is related to the elbow joint, both of which are hinge joints, and the cubital fossa is having the structure of a triangular hollow, whereas the popliteal fossa was actually diamond shaped. It was actually diamond shaped. That's the first point of difference that is there. Now, what is important whenever we talk about such fossa or such any anatomical space is the boundaries and the contents. Besides that, we'll also consider the clinical anatomy. To talk about the boundaries, let me just go over the boundaries for you. So I made these notes for you that so that it's very easy for you to just go through everything. The lateral boundary, like I told you, it's a triangle. So there will be three boundaries. There's going to be a base, there's going to be a medial boundary, there's going to be a lateral boundary, right? So the base, first of all, it is upwards. It is pointed upwards. So you can see the apex is pointed downwards and the base is directed upwards. All right. And it is represented by an imaginary line joining the front of the two epicondyles of the humerus. So the medial epicondyle and the lateral epicondyle. So if a line is drawn joining the two epicondyles here, right, and that is an imaginary line, that will form the base of the cubital. You have to remember that the one of the boundaries of the cubital fossa is actually imaginary. One of the boundaries of the cubital fossa is actually imaginary. Now, what will be the lateral boundary? So here, lateral side, the muscle that is present here on the lateral boundary is the brachioradialis. The medial border that is towards the inside, the medial border of the brachioradialis will form the lateral boundary. And medially, you have a muscle that goes obliquely here. And muscle that goes obliquely here is the pronator teres. Goes medially, its lateral border, right? Its lateral border of the pronator teres, it will form the medial boundary. I'll just show you that in the image also. So for example, if here medially you have the pronator teres running, so this will be the lateral border of pronator teres. And here if you have the brachioradialis running, right? Let's say this is the pronator teres, the one that I've shaded in red. And let's take another color. Now this one that I've shaded in green, that's, let's say, the brachioradialis. So the medial border towards the medial side of the muscle is the medial border of brachioradialis forming the lateral boundary, and the lateral border of pronator teres towards the lateral side. So this is the lateral border of pronator teres, and it will form the medial boundary. Besides that, you have this base which is directed upwards, and it is represented by an imaginary line joining the front of the two epicondyles of the humerus. Clear? The three boundaries must be crystal clear to you, and these three boundaries you must also try and remember. You must be remembering these three boundaries. Used to be a very important question for the prof examinations, right? Besides that, it's very obvious there is an apex for the triangle. This is the apex for the triangle, and you can see it is directed downwards. The triangle directs downwards, right? And it is formed by the area where the brachioradialis crosses the pronator teres. Pronator teres is a relatively short muscle, so the brachioradialis it will cross the pronator teres at the apex. All right, let's have a look at this diagram. It will give you an orientation of the exact border. This tendon that you can see, it is the tendon of biceps. This is the tendon of biceps, right? Let's clear this out. This muscle that you see here, it is the biceps, and this tendon you see, it is the tendon of the biceps, right? It is the content of the cubital fossa. Right now not relevant, but have a look here. This muscle here, this large muscle, large thin muscle, absolutely located on the lateral border, that is the, so this is the entire muscle is the brachioradialis. So this is the medial side, the medial side, sorry, this is the lateral side obviously, and this is the medial side, because the lateral border is towards the lateral side, right? And your, if you look at in the anatomical position, your thumb is outwards, so your thumb is towards the lateral side. So medial border of brachioradialis. So this is the medial border, and this is the lateral border. So the boundary will be formed by the medial border of the brachioradialis, and the medial border will be formed by the lateral border of the pronator teres, right? So those are the medial and the lateral boundaries, and this superior border here below you will have the medial epicondyle. This will be the medial epicondyle just beneath it, and here you will have the lateral epicondyle. So there's a imaginary line joining these two structures that will be forming the superior border, or you can call it the base of the triangle. Call it the base of the triangle. This is the apex where you can see the brachioradialis is crossing over the pronator teres. Alright, that is about the boundaries of the. Now, once the boundaries are done, what is there? Now there must be, so if this is a 2D structure that I have drawn, right? So it is actually, cubital fossa is actually a volume. It is not an area, alright? So since it is a cuboid, not exactly a cuboid, but also a 3D space. So just there should be these 2D boundaries, and then there should be a roof, there should be a floor, and there would be some structures that are passing in between. There's a roof to the cubital fossa, there is a floor to the cubital fossa, and there is a contents of the cubital fossa. If I have to draw a schematic for the cubital fossa, if I have to draw a schematic for the cubital fossa, this is the 2D projection. Now just imagine that this will go downwards like this, thing like this, which means that this is the roof of the cubital fossa, this is the floor of the cubital fossa. These were the boundaries, the medial, the lateral boundaries, right? And besides that, you have certain structures passing inside. So those are the contents of the cubital fossa. All right. So now we've talked about the boundaries. Now let's talk about the roof and the floor. If you look at the roof of the cubital fossa, what is the structure that you see? What is the general pattern of any structures that you see? You have the skin, you have the superficial fascia, and then you have the deep fascia, right? This is the general schema, right? For any structure from outward, right? So here you have the skin, superficial fascia, and deep fascia, right? Now there is another layer which is basically a modification of the deep fascia. Any aponeurosis is essentially a modification of the deep fascia. You have the bicipital aponeurosis, which is deeper to the deep fascia, and it is forming the most inferior structure of the roof, the bicipital aponeurosis, right? It is forming the bicipital aponeurosis. It is very important, especially with respect to the median cubital vein. Now, what is the medial cubital vein? I've already talked here, so you can see here skin, superficial fascia, deep fascia. Now, the superficial fascia in the cubital fossa has a few structures that are passing through it, right? The superficial fascia, it contains something called as the median cuboidal vein, which is the preferred site for intravenous injections. Remember, there is generally whenever they have to draw blood or they have to take an injection, they usually inject it here. The reason for that is that the superficial fascia contains a vein called as the median cuboidal vein. That is where the injection is usually put. Alright, if it is missing, then it is put in the basilic vein, not the cephalic vein. We'll come to that. What happens is the superficial fascia contains the median cubital vein. Superficial fascia contains the median cubital vein. And besides that, median cubital vein, it is essentially a connection. The median cubital vein is a connection between the basilic vein and the cephalic vein, right? Which allows the blood of the cephalic vein to shunt to the basilic vein, right? Not on the obliquity in a very anatomically correct way, but you get the point, right? It is an oblique structure, right? Which runs medially and upward. So, lateral cutaneous nerve of the forearm. The lateral cutaneous nerve of the forearm, since on the lateral side you have the cephalic vein, because cephalic vein, it is a content of the anatomical snuff box. It passes through the roof of the anatomical snuff box. So anatomical snuff box lies on the lateral side, related to the thumb, right? So this is the lateral side. The lateral cutaneous nerve of forearm will lie along the cephalic vein. On the medial side, you have the basilic vein. On the medial side, you have the basilic vein. The medial cutaneous nerve of the forearm will lie along with the basilic vein, right? So what is happening essentially is there is the basilic vein on the medial side. There is the rock here on the medial side. The medial side, you had the basilic vein running. On the lateral side, you had the cephalic vein running. Now the cephalic vein, it has to give some blood. It has to shunt some blood to the basilic vein, and it does that via the median cubital vein, right? And this is the vein that is present in the superficial fascia of the cubital fossa. You will see all the three veins. You will see all the three veins, and along the basilic vein, because it is on the medial side, you will have the medial cutaneous nerve of the forearm, and along with the cephalic vein, you will have the lateral cutaneous nerve of the forearm. So that is the exact distribution of the roof. So what are the structures that are present in the roof of the cubital fossa? So now if I have to name the structures present in the roof of the cubital fossa, what will those be? Structures in the roof of cubital fossa. I will write how many structures? Five structures, right? What are the five structures? Median cubital vein, right? Besides that, basilic vein. Along with basilic vein, you will have medial cutaneous nerve of the forearm. Medial cutaneous nerve of the forearm. Apart from that, you will have the lateral cutaneous nerve of the forearm, which was accompanying the cephalic vein, right? These are the five structures that will be present in the roof of the vital vein, right? This is a very good pictorial representation of that. You can see here, this is the cephalic vein running on the lateral aspect along with the lateral cutaneous nerve of the forearm, which is basically a continuation of the musculocutaneous nerve, if you remember some of the previous points. Then you have the medial cutaneous nerve of the forearm, which is coming from the medial cord, right? It comes from the medial cord and it runs with the basilic vein. It runs with the basilic. So this was the basilic vein, this was the cephalic vein, and it runs obliquely upward and medially. So you can see that it runs the median cubital vein. This is the medial cubital vein. It is around 2 to 2.5 centimeter. It runs obliquely. And how does it run? It runs medially and upward. It runs medially and upward. And as you can see, deep to these structures, the deepest layer you will have the bicipital aponeurosis, right, on which the median cubital vein is resting. And because of that, it is protected from the brachial artery. The bicipital aponeurosis, it separates the median cubital vein from the brachial artery, right, and it allows the deep perforators to pass through it. Thereby, it fixes the median cubital vein on itself. So, bicipital aponeurosis is very important for the reason that it allows the median cubital vein to be fixed on itself by allowing perforators to pass through it, and it separates it from the brachial artery, thereby making median cubital vein the vein of choice for intravenous injections. After that, the second option is the basilic vein. If the median cubital vein is absent, you go with the basilic vein. Why? Because basilic vein is a more efficient channel for drug delivery or for whatever you are delivering through the intravenous injection. And the basilic vein is also more straight. It is more straight, so it does not the blood does not have to follow a weird path. All right, it does not have to follow a two curved path. All right. So the answer in that case is the basilic. The second choice is asked. Right. The other two clinical points relate to the median cubital vein. Now, if you talk here, now we've come to the floor. Now we've come to the floor of the cubital fossa. There are two muscles that form the floor. One is this large muscle, that is the brachialis, that is running here. This is the brachialis muscle, right? The brachialis muscle. The second muscle is this muscle here that is present below, that is the supinator muscle. There are two muscles, the brachialis and the supinator muscle, that will form the supinator muscle is present on a little on the lateral side, running towards the medial side, which is surrounding the upper part of the radius bone, right? So these two muscles, they will form the essentially they will form the floor of the cubital. If you talk about the contents of the cubital fossa, if you look at them from the medial to the lateral side, so we're done with the boundaries, we're done with the floor, we're done with the roof of the cubital fossa. Let me just do, want to make sure I have. If you look at here, if you look at the contents of the cubital fossa, and you look at them from the medial to the lateral side, all right, you're looking at the medial side. Sorry, this is the lateral side. This is the lateral side, and this is the medial side. Now, if you look at the contents from the medial to the lateral sides, you might have heard of this mnemonic time and again. M D E R, or I prefer to go with yes. I prefer to go with MBBS. Now I'll just tell you what is the mnemonic. The first structure that you see there, the median nerve, is the median nerve. Alright. First structure that you see is the median. The second structure, so what a lot of people do is that they get confused between the second B and the third B. Alright. Now let me tell you, the second B is the brachial artery. Second B is the brachial artery and its bifurcation into the radial and ulnar arteries. And the third B is the tendon of biceps brachii. It is the tendon of biceps brachii, right? Biceps brachii means arm, right? And S here is the superficial branch of the radial nerve. The superficial branch of the radial nerve, or you can simply write radial nerve, right? For simplicity. Although we'll talk in detail about the radial nerve also. We'll talk about each of these structures in detail, don't worry. But here what I want to tell you is that, see, this is brachial artery. A for artery and B for brachii, biceps brachii. Now, if you know the first letter, then look at the second letter. A for artery. A comes before B in the alphabet, right? So artery will be more medial. It will come before, and then you will have the third one will be B for brachii. A B. All right. A MBBS, and this is for the second letters to make sure that you remember that the artery is more medial to the tendon of biceps brachii. Although this point is clinically very important, all right? When you have to measure your blood pressure, when you have to measure your blood pressure even for your practicals, how do you identify the brachial artery? So what you do is you ask the patient to flex his arm, right, which makes this tendon very prominent, and then medial to the tendon, somewhere medial to the tendon, you will have the bifurcation of the brachial artery in the cubital fossa, and that is the point where you have to put your cuff. So it is very important to know that in the contents of the cubital fossa, what is the order from the medial to the lateral side. So you have two nerves, one artery and one tendon. All right, very important to know this. So just have a look here. So the medial border, the medial boundary is being formed by the pronator teres. Medial most structure is the median nerve. Then you have the brachial vein and the brachial artery running here, right? So the vein is a little more medial, and that is what is happening here. Then you have the ulnar vein and the radial vein, the radial artery and the ulnar artery, again related to the brachial vessels. So then beside that, here you can see the biceps tendon. It is running here, and the radial nerve, the deep branch, it is going between the deep radial nerve. So the radial nerve, it comes in the cubital fossa and it divides into the superficial branch and the deep branch. The deep branch is known as the posterior introitious nerve. The deep branch, it disappears, alright, whereas the superficial branch, it keeps on running around along the lateral border. That is the lateral border is the actually the medial border of the brachioradialis, right? So it keeps on running under the cover of the brachioradialis, and you have to actually retract the brachioradialis to be able to see the superficial branch of the radial nerve, but it is a content of the cubital. Remember, the superficial radial nerve, the superficial branch of the radial nerve is a content of the cubital fossa. And this is the superior border, which is an imaginary line between the two epicondyles. So it is also known as the epicondylar line. Therefore, it is also known as the epicondylar line. That is the superior border of the cubital fossa. Alright. So this is this much for this. Then, if you have a look at this a little more, you have a look at this a little more. What I want to show you here is the median nerve. The first thing that I want to show to you is the median nerve and a little bit of the other structures as well. If you have a look at the contents, you can see the medialmost structure that was running is the median nerve, and then it passes between the two heads of pronator teres. Then it passes between the two heads of the pronator teres. This is the ulnar head of the pronator teres, and then this is the radial head of the ulnar this is the humeral head of the pronator teres, right? So the humeral head, the ulnar head. The median nerve, it passes between these two heads of the pronator teres. Therefore, it can get compressed in between these two heads, which is known as the pronator teres syndrome. It is known as the pronator teres syndrome, but the medial most structure is the median nerve. Okay. After that, you can see here what is the artery that is going. This artery is the brachial artery, right? More superficial, you can see the so it divides here into two. It divides into the radial and the ulnar arteries. You can see which is the more superficial one. The radial artery is clearly more superficial, and the ulnar artery, it goes deep to both the pronator teres muscles. It goes deep to both the heads of the pronator teres. So between the median nerve and between the ulnar artery, you have the deep head or the ulnar head of the pronator, right? So this is the second most medial, alright, brachial. After that, you have the tendon of the biceps, third most medial, alright, third most medial. This is the third structure that is there. And then you can see that there is a deep branch of the radial nerve. There's a deep branch of the radial nerve which goes and it disappears, right? And it forms the posterior introitious nerve, right? It will form the posterior introitious nerve. The anterior introitious nerve, it is formed by the median nerve. The anterior introitious nerve, it comes from the median nerve. And then there is a superficial branch of the radial nerve which runs for a short distance here in the cubital fossa. And it runs under the cover of the brachioradialis. Runs under the cover of the brachioradialis. So you know about the biceps. So this is the tendon of the biceps. Then I have told you about the radial nerve, which is dividing into the superficial and the deep branches. The deep branch goes deep to the muscles here, deep to the supinator muscle, the superficial head between the two heads of the supinators, if you will. And there is a superficial branch, there is a radial artery, anterior introitious nerve coming from the median nerve, the two bones, the radius and the ulnar artery, which is very deep, deep to the ulnar head of the pronator teres, and the ulnar head of the pronator teres separates the ulnar artery from the median nerve, right? Because the median nerve passes between the two heads of the pronator teres, where it can get compressed to give rise to pronator teres syndrome. So just have a look here. This is the humeral head coming from the humerus pronator teres, the humeral head of pronator teres, and the ulnar head of the pronator teres. Between them, you have the median nerve running. Between them, you have the median nerve running. It supplies the flexor digitorum superficialis. It basically supplies the superficial flexors here. It is the muscle of the forearm, also known as the laborer's nerve. So it will supply all the flexors that are present in the anterior compartment of the forearm. All right. The median nerve, it gives branches to flexor carpi radialis, palmaris longus, and flexor digitorum superficialis. Just remember about this flexor digitorum superficialis, especially because it is responsible for the flexion of these. So that is median nerve giving branches to the flexor carpi radialis, palmaris longus, and flexor digitorum superficialis in the cubital fossa, and it leaves the fossa by passing between two heads of the pronator teres. That is the ulnar head and the humeral head, and that is one of the possible sites of its compression, which will give rise to pronator teres syndrome. So that is all that you need to know about the median nerve. Second thing that I just told you, it is regarding the termination of the brachial artery and the beginning of the radial and the ulnar artery. So the first content, that was the middlemost content, was the median nerve. The second content is the termination of the brachial artery and the beginning of the radial and the ulnar artery. The radial artery, please do remember, it is smaller, right? Second, I showed you that it is more superficial. I just showed you in the diagram of the contents of the cubital fossa that the radial artery is much more superficial as compared to the ulnar artery, because the ulnar artery, it runs deep to the ulnar head of the pronator teres, whereas the radial artery remains more superficial. Then you have the radial recurrent branch. So if this is the brachial artery, it divided into the radial and the ulnar artery. The radial artery gives a branch that is known as the radial recurrent branch. So you will see that the ulnar artery gives multiple recurrent branches, and all of these will have a significance when you talk about the anastomosis around the elbow joint. When you talk about the anastomosis around the elbow joint, just remember for now that the radial artery gives a radial recurrent branch. Right? Now, if you talk about the ulnar artery, it goes deep to both the heads of the pronator teres. Just like I told you, it goes downwards, it goes medially, and it is separated from the median nerve by the deep head of the pronator teres. See, the ulnar artery. Wait, let me just draw. Uh, so if these are the two heads of the pronator teres. Let's say this is one of the heads of the pronator teres. Let's say this is the humeral head. Let's say this is the humeral head, and this is the ulnar head, right? Now what happens between these two? Between these two, what passes? The median nerve. The median nerve, it passes between the two heads. Median nerve passes between the two heads. Whereas the ulnar artery, it follows a different path. The ulnar artery, it will run deep to the both heads, right? Ulnar artery. So the median nerve and the ulnar artery, they are separated by the deep head or the ulnar head of the pronator teres. Alright, now you will be able to understand this point. So then the ulnar artery, it gives off the anterior ulnar recurrent branch, it gives the posterior ulnar recurrent branch, and the common introitious artery. So remember that the common introitious artery, it arises from the ulnar artery, not from the radial artery. And then the common introitious artery divides into the anterior introitious and the posterior introitious. So the ulnar artery, it gives rise to the common introitious artery, which divides into the anterior introitious artery and the posterior introitious artery. Then the posterior introitious artery, it gives a recurrent branch known as the introitious recurrent. Gives of the introitious recurrent branch. So what are all the recurrent branches that you know? What are all the recurrent branches that you, right? So you know the radial recurrent branch, anterior ulnar recurrent, posterior ulnar recurrent, and then from the posterior introitious artery there is a introitious recurrent artery. So there is a total of four branches here, which are recurrent branches of the various arteries. There are four recurrent arteries. All right. So have a look here at the anastomosis around the elbow. I'm not going into the details right now because for that we'll also have to talk about a little bit about the profunda brachii vessels, right? Because they have collaterals that are coming from above. So what happens is that the vessels that are present superiorly, they will give collaterals. The vessels that are present inferiorly, they will give recurrents. These collaterals and these recurrents will form an anastomosis around the elbow. You can make out here, this is the anterior ulnar recurrent, this is the posterior ulnar recurrent, this is the radial recurrent going anteriorly, and this is the introitious recurrent coming from the posterior introitious artery and will go posteriorly. So what are the recurrents that are present anteriorly? Anterior ulnar recurrent and radial recurrent, right? And what will be present posteriorly? So the interosseous recurrent, it is coming from the interosseous, posterior interosseous artery. So it is going to be present posteriorly, and the posterior ulnar recurrent has the has the word posterior in its name. So it will also be present posterior. Will also be present. So I hope the lower part of the anastomosis is clear to you. We will be able to study the anastomosis in detail in a separate lecture maybe, or as part of some other topic. Not going into the details because I don't want to go into the details of the brachial and the profunda brachia vessels, right? So these are regarding the recurrents. Then the third content of the cubital fossa. Let's not forget the tendon of the biceps brachii. So why do we use the words biceps brachii? Because there's also a biceps femoris that is present in the lower limb. So brachii refers to the fact that it is a muscle of the upper limb or the muscle of the arm. Then lastly, the last content is going to be the radial nerve, which descends medial to the lateral epicondyle, which means that if this is the lateral epicondyle, a little medial to it, you will have the radial nerve, which is descending here. In the fossa, it gives off a posterior interosseous nerve, which is also known as the deep branch. Deep branch goes deep to the supinator and it supplies the supinator, of course, and it supplies the extensor carpi radialis brevis. Meaning you have the superficial branch which runs in the front of the forearm for some distance, then it goes towards the side and becomes the content of the anatomical snuff box. The roof of the anatomical snuff box, you will find the superficial branch of the radial nerve running there as well. Right? So what were the contents? Let's just go through them again. What all I want you to see, this was the roof. So in the roof, you can see that this is the basilic vein. Along with that, this probably will be the medial cutaneous nerve of the forearm. Right? Medial cutaneous nerve of forearm. Similarly, on the lateral side, here you might have a few structures here, which is the cephalic vein, right, which will be running here. Then here, what structures I want you to appreciate? First, I want you to appreciate the median nerve. Then I want you to appreciate the brachial artery, which will here divide into the radial and the ulnar arteries, right? Then I want you to look at the pronator teres, between which you will have the median nerve passing, which will be covered by the bicipital aponeurosis, which is coming from the biceps. Then you will have to appreciate the tendon of the biceps, and besides that, I want you to appreciate that the floor is being formed by the brachialis, and that's it. That's about this, more or less about this diagram. That all you can appreciate in this diagram. This is a more schematic diagram where you can make out what I want you to see here. What I wanted you to see here mainly was the tendon of the biceps. I wanted you to see the tendon of the biceps, which was present lateral to the brachial artery. So remember, the brachial artery is present medial to the tendon of the biceps. Very important for your blood pressure measurement practicals as well. Alright. So now here you can look at the boundaries. You can make out the boundaries of the cubital fossa. Alright. This is the imaginary line that is drawn. This is the epicondylar line that has been drawn for you. You can see between the two heads of the pronator teres, you have the median nerve. Then you have the brachial artery, where the ulnar artery is going deep to the ulnar head of the pronator teres, and the radial artery is more superficial. Then what was going here is the tendon of the biceps, and then this is the radial nerve coming medial to the lateral epicondyle. And then what happens is it divides into the superficial and deep branches. The superficial branch, it is a content here and it runs under the cover of brachioradialis. And the deep branch of the radial nerve, also known as the posterior interosseous nerve, it will pierce the supinator and it will go deep. It will pierce the supinator. Alright. Now this is a very beautiful diagram which shows everything, which shows literally everything that is there about the cubital fossa. Before we move to the clinical, it is very important for you to know all of this. Alright. So again, a very quick summary here. First of all, what are the boundaries? The superior border or the base is the epicondylar line. Then the medial boundary and the lateral boundaries you have to know. The lateral boundary will be the brachioradialis and the medial boundary will be the pronator teres. The lateral boundary of the pronator teres will be the medial boundary of cubital fossa, and the medial border of the brachioradialis will be the lateral boundary of the cubital fossa. Look here, what is the first nerve that you will be able to appreciate? This nerve that you can appreciate is the lateral cutaneous nerve of the forearm. Alright, this is the lateral cutaneous nerve of the forearm, which will be present in the of the roof of the uh, cubital fossa, right? The superficial fascia. And this is the medial cutaneous nerve of the forearm. This will be accompanied with the basilic vein, and this will be accompanied with the cephalic vein, the lateral cutaneous. Now, what are the four structures that will be present? The first structure, that is the medial most structure, this is the fossa, right? So that you can make out that this muscle that you see here is the brachioradialis. This is the medial border of brachioradialis. This muscle that you make out on this side, this thick muscle, is the pronator teres, which has two heads, right? So this is the median nerve, which is going here. The median nerve, it is going towards this side, right? This is the median nerve. The median nerve, it will pass between the two heads of the pronator teres, right? So medial most structure, this is going to be the right towards the medial side. Now then, after doing that, it gives so it will obviously supply the median nerve. It will supply the pronator teres, right? Because it passes between the two heads of the pronator teres, it will obviously supply the pronator teres. Besides that, there are no other branches that you need to know, but you need to know that it passes between the pronator teres, right? The ulnar head and the humeral heads, between two heads. All right. So besides that, let's talk about the brachial artery. The second thing here is the brachial artery. This was the median nerve. Second structure here is the brachial artery. So this is the brachial artery coming from above, dividing here into two, the radial and the ulnar artery. So you can see that the ulnar artery goes deep, and what remains superficial is the radial artery. So that is the radial artery. Besides that, you have the ulnar artery. Now the ulnar artery gives an anterior ulnar recurrent, like I told you, and there is also a posterior ulnar recurrent, which is not shown here. Now, apart from that, you know that there is a muscle here, that is the flexor carpi radialis, which will again be supplied by the median nerve along with the flexor digitorum superficialis, because it is a nerve of the forearm that is also called as the labral nerve, right? So besides that, here look at brachioradialis. I've already shown you that supinator lies in the floor of the fossa. The supinator, it lies in the floor of the fossa, and it is pierced by the deep branch of the radial nerve. You can see the deep branch of the radial nerve piercing the supinator muscle, right? So this is the deep branch of the radial nerve, and as you can make out, the content here in this case is the superficial branch of the radial nerve. So that is why I told you to remember the mnemonic MBBS instead of MBBR, because there's some controversy with regards to this point, right? PDC writes radial nerve, whereas other more reputed books, they will write superficial branch of radial nerve instead of radial nerve. This is wrong. This is a little more correct. You can make out that the deep branch of the radial nerve, it will go ahead, it will pierce the supinator, and it will not be seen much in the cubital fossa. Whereas the superficial branch of the radial nerve will be seen under the cover of the brachioradialis. So then I told you that there's an artery coming from the radial artery known as the radial recurrent artery, which is also present anteriorly. So the anterior recurrent arteries you will be able to appreciate in this diagram, right? And then besides that, the third structure was the tendon of the biceps. This is the biceps coming, which is again present lateral to the brachial artery, or you can say the brachial artery is present medial to the tendon of the biceps. I have shown you the deep branch of the radial nerve piercing the supinator. The deepest structure of the roof is the bicipital aponeurosis, over which you will have the median cubital vein line. Then this is the radial nerve, already shown to you. And then this muscle, this large muscle here in the floor, is the brachialis. The floor on this side, it is formed by the supinator near the radius, and on the upper side it is mainly being formed by the large part of the floor is being formed by the brachialis, right? That is about the entire thing related to your cubital fossa. If I come here, remember I started with the boundaries, right? We did away with the three boundaries. After the boundaries, we talked about the roof, which was skin, superficial fascia, deep fascia, and bicipital aponeurosis, with five structures present inside the superficial fascia. These were the five structures that you need to know for the superficial fascia. Then after that, we moved to the floor, being formed by two muscles, mainly by brachialis, accompanied with the supinator. There were four major contents, and the mnemonic for that was MBBS. And we talked about the median nerve, the cubital fossa, and the pronator teres syndrome. We talked about the brachial artery, the radial artery, the ulnar artery, their recurrent branches here, right? One recurrent by the radial artery, three recurrents by the ulnar artery, all right? And I told you which was anterior, which was posterior, which will now help you understand the anastomosis around the elbow, all right? So that should give you a lot of clarity here with this diagram, right? This particular diagram is for maximum clarity with regards to everything of the cubital fossa. Now, there are a few clinical points that I have to stress a little more upon, because Clinical anatomy is obviously more relevant whenever you talk from any examination pattern, especially from the next examination pattern. We've been very clear that clinical anatomy will have much more weight. Right? The median cubital vein, it is preferred for IV injections. So as you know, it is present in the roof of the cubital fossa in the superficial fascia, right? Is present in the roof of the cubital fossa in the superficial fascia, right? Now, why it is the vein of choice for IV injections, cardiac catheterizations, blood draws, or any procedure where you have to stick a needle inside the elbow? Because the medial cubital vein, first of all, it is fixed by the bicipital aponeurosis. It stays in its place because there is a deep perforator which passes deep to the medial cubital vein through the bicipital aponeurosis. Because of that, the medial cubital vein, it does not move much. Okay. Otherwise, if you put a needle, the vein will move towards the other side, right? The medial cubital vein, it remains fixed. Second thing, it is very difficult for you to pierce the vein and then touch the artery, all right? Because in between them, you have the bicipital aponeurosis. Okay. Even if your needle goes too deep, you will realize that the bicipital aponeurosis has come now, and you will feel that it is much more thick, and so you will not pierce the needle into the brachial artery. So there is very less chance of injuring the brachial artery here. So that is why medial cubital vein is the vein of choice. If medial cubital vein is absent, then you go for the basilic vein because it is a more efficient channel for delivering whatever you want to deliver through the IV injection, and it is also more straight, right? Second thing is measurements of BP. They are done in the cubital fossa over the brachial artery. Brachial artery pulsations, they can be felt medial to the tendon of the biceps, right? And then they are used for recording the BP by putting the cuff here. यार 2 मिनट रुक जा, 2 मिनट में आता हूँ bro. Then third point here is regarding your elbow fractures. The third point here is regarding your elbow fractures, which means you should know the various recurrent arteries, then anastomosis around the elbow. For example, supracondylar fracture of the humerus. So that is where you have the clinical importance of the cubital. That is where the cubital fossa is very relevant, and that is why it is very important for your entrance examination. Thank you so much for watching this video. If you like this video, do hit the like button, all right, and do watch more videos here on the channel. There's so much free content for you all to watch. Go hit the subscribe button and do press the bell icon for notifications that will tell you when we are live or when some video is being uploaded here. My referral code is Chaitanya10, as I already told you that you can get a 10% off, and you can also get credits, and you can also get a certain amount of cashback from my end. So you can contact me on Instagram at the rate chaitanya.blue. That's my Instagram handle. And as far as Telegram channel is concerned, my Telegram channel at the rate NEET Chaitanya. And if you like this video, please do drop a comment in the comment section. That will really motivate me to make more such videos. Thank you so much for watching. I hope I have been able to get across cubital fossa to you, and I hope I have been able to deliver what I wanted to do. Now you can attempt some MCQs for cubital fossa, and if you can't find any, I will try and provide you with some. The main things, just to summarize: boundaries, roof, floor, clinical anatomy. So I've told you 5 points, out of which most important is obviously the contents. Okay, the boundaries in this. So that's about this lecture. Thank you so much for watching. Like I already said, please try to drop a comment if you can, and do subscribe to the YouTube channel, that is Let's Crack Neat, where we'll be giving you the qualitiest content. And like I said, do download the Unacademy Learning app. There's a lot of free special classes for you to watch there. Do take maximum advantage of whatever free content you can get from us. Besides that, I've already told you about the subscriptions. If you find all of this to be useful, I assure you the Unacademy Plus platform will be really beneficial for you. If you take the Iconic subscription, you also get a plan. Thank you so much. It's just patient. The video in